My first key point is I'm going to present some data from cricket and some data from Aussie rules football, Australian football, and if you remember that I included Australian football in this presentation and why, it will help you understand hamstring injuries a little bit better. So if you haven't ever seen Aussie rules football, it's not easy to see anywhere else in the world, but you can look at a video. It's a game which is played on a cricket field. So if there is a trivia question for our faculty trivia tonight, which football game gets played on a cricket field, then it will be the Australians who will hopefully get the quickest on the buzzer there. Being a game with 18 players on each side, so 36 players on the field at any given time, the size of the ground is very large, and that's a key difference between Australian cricket fields and cricket fields almost everywhere else in the world. So the MCG, I think, is the largest cricket field in the world by surface area. And cricket is a sport, unlike many sports like football, where the size of the ground is not standardised. And again, very interesting to think about that and what it means for injuries and tactics and those sort of things. So anyway, next slide. Do I push them myself or do I call for them? I'll just push a button there. That's better. Okay, so that's a picture of. Oh, fantastic! Even better. Okay, that's a picture of Aussie rules football, Australian football. If you haven't seen it before, so I'm going to present 3 studies in one here. This one is an Aussie rules study that got published in the British Journal of Sports Medicine in 2020, and we found a finding that's a little bit boring now because you've seen it before, that past history and recent history of hamstring strain is by far the biggest risk factor for hamstring strain, so that's very well known. More interesting topic or more interesting finding were that we found a logarithmic decay for recurrence, so that have a high rate of recurrence on the first week back from injury, medium risk on the second week back, and it just drops slowly to baseline. It takes about 3 months. So someone who's coming back from a hamstring strain is at elevated risk for the next 3 months, and I'll show you that graph later on. But that's from the Aussie rules data, not the cricket data. The cricket data, this one you can look up because it's an open access paper, and if you're interested in this topic, Journal of Sport and Health Science, 2017, risk factors for hamstring injuries in Australian male professional cricket players. The key findings from the abstract there that are worth remembering, and they're your key take-home points in cricket. It shows the interesting speed v fatigue nature with hamstring strains, that they are a speed-related injury and a fatigue-related injury, which is fascinating because that sounds like it's a paradox, and it really is. So the playing position most likely to get a hamstring strain is fast bowlers overall, and they particularly get hamstring strains in 4-day cricket or 5-day cricket through the fatiguing elements of having to repeat efforts over an extended period. And then batters get hamstring strains in white ball cricket, but more so we found 50 over cricket than 20 over cricket. So the highest risk format for a batter was 50 over cricket, not 20 over cricket. But they are still quite common in 20 over cricket as well. But it's more the batters and fielders in T20 cricket, and it's more the fast bowlers in red ball cricket. So that's key take-home message about hamstring, and it makes you start to think about speed being a risk factor and fatigue also being a risk factor. And so when you're sprinting under fatigue conditions, it's when you're most likely to strain a hamstring. The second point that comes up in that abstract gets back to my original point. Our players were more likely to do a hamstring playing in a match in Australia compared to playing anywhere else in the world. So for our Australian players, it's a protective factor against hamstring strain to play overseas on a smaller ground. The reverse of that, we don't have data for because we don't keep injury data for visiting teams, but anecdotally I can tell you that if you want to do a hamstring in cricket, the best way to do it is to tour Australia as a visiting team, and almost all the visiting teams who come to Australia end up doing a lot more sprinting than than they normally do because the grounds are so large. So you have a lot of 2s and 3s, and that affects the batters and the fielders. So having small grounds means more boundaries. You hit a 4 or a 6, no one has to really run that hard. If you hit it to the outfield, that's when everyone's sprinting. And that happens lots more. There are stats to back that up. That happens a lot more on Australian grounds than on grounds elsewhere in the world because our fields are so big, because we play this stupid brand of football on the same ground and we have to have lots of room for all the players. So be aware if you're taking a team to Australia that you will need to do a lot more sprint training in the lead up and hopefully get your hamstring strains out of the way in your training in the lead up than to do them on the ground when you do a lot more sprints on the field than you're accustomed to doing. So it is a pitfall of touring Australia. I think one year in the Big Bash League we had 7 or 8 international players, and it was an abnormal year, do hamstring strains. So it's also common in the BBL. Players fly over playing on smaller grounds usually, and they play on larger grounds. They sprint more than they would be otherwise doing. The risk compared to Aussie rules football and cricket, the relative risk in cricket is about half, but it's still fairly substantial. So in any given game, from our data set, was 0.4% of players will strain a hamstring in any given game. So it's not common, but it's not rare. It's just an uncommon injury that happens over the course of a season many times, but on any given day, it's not likely to happen to a player, 0.4%. This is from that Aussie rules data, and this one is worth a photograph if you've got your phone here. So some of the more minor factors are all quite interesting. The really common ones are recent hamstring strain, past hamstring strain, recent calf strain made you more likely to strain a hamstring. If you're an Indigenous player, and in Aussie rules, the Indigenous players are very good. They make up about 12% of the Aussie rules competition. They're only 3.5% of the Australian population. They're overrepresented in Aussie rules because they're excellent at the sport, because they're very fast, and they're speed-orientated players that often will burn off other players with their pace, but it does make them a bit more susceptible to hamstring strains. Interestingly, there was a protective effect if you've had a concussion in the past for not doing a hamstring, and my interpretation of that is that's likely to be a confounder, that in Aussie rules, the players who are the speedy players are probably not involved in the contact as much, a bit like the backs in rugby and the ones who are involved in the competitions to get the ball are more likely to get concussions, but they're less likely to be running fast away from the other players. But that's not really relevant for cricket, so don't worry too much about it. But also, if you've had a past ACL reconstruction, you are more likely to do a hamstring. And that one's really obvious because the majority of players who get an ACL reconstruction use a hamstring graft, and that's a negative to take into account when you have a player who is getting an ACL reco, that they will be more likely to sustain a hamstring strain down the track. It does weaken the hamstrings, and it suggests that maintaining strength is important. And this is the really interesting graph from that Aussie rules study, that on your first week back, you're about 8% likely to restrain your hamstring. Second week back, 4%. Third week back, 3%. But we had so many hamstring strains that the graph is really beautiful. Like, it's a line of best fit, but you can actually see the raw data fits in superbly, showing how you regain your strength over time, and you're actually carrying that hamstring strain for many weeks. We do know that 100-metre sprinters don't come back nearly as quickly as team sport athletes, because they can't, at 3 weeks, they can't run a fast 100-metre time because there's no one protecting them. What team sport athletes do is they're probably playing with a weak hamstring for the first 4, 6, 8, 10 weeks back, and they're not running quite as fast as they normally run to protect themselves, but they can still do a good job in a team sport where they don't hit full pace. And this is one, I think this is the last slide and then I'll finish early. This is from a study that we're about to publish, or about to send in for publication in a couple of months. One of our registrars studying in Sydney with me is analysed about 200 MRIs of hamstrings to see whether MRI severity correlates with time out, and it does. Very similar to the other sports, that the correlation is weak, but it's there. So other factors other than MRI severity are also important, because there wasn't a super strong correlation between MRI severity and time missed, but there was a correlation, and in particular the grade of hamstring was more important. That's grade 1, grade 2, grade 3 over the left, and that is BAMIC type A, B and C, and there's a little bit of a kick on BAMIC type C, so you miss a little bit more time if you had tendon involvement on the MRI. So they're factors to take into account, but don't assume that MRI is a magical tool to tell you exactly how many weeks you're going to be out for. Clinical factors will play an important part in the decision, and the format that you're coming back into will play an important part. If you're coming back as a batter in red ball cricket, you might be able to come back with your hamstring not quite rehab that well, because you don't have to hit full pace nearly as much. You hopefully are not taking any suicide runs in red ball cricket because you don't need to, and therefore you can run at 80% pace between the wickets, and you might be able to fill in slips, which you can't normally in T20 because they don't have slips, but you can protect yourself as a non-bowler in red ball cricket, and that would allow them to come back a bit earlier.